Hello, everybody. Thank you for joining us for another episode of the BAM. And today we have actually somebody who is a neighbor of mine and I've known for several years now, Allison Galloway. Allison actually has two kiddos who have a genetic disorder. Am I saying that correctly?
You got
Okay.
it.
A genetic disorder. And so she and her family have put on a 12K or a 5K fundraising run for how many years now, Allison?
This will be our 9th year this year.
For 9 years. So when she advertises it every year, I either participate or donate. A lot of times it falls on a time I can't go, but I at least, donate to the cause. But I thought it would be great to have Allison on the show, educate us all a little bit about this, tell us how she navigates, being a badass mom to two kiddos with that need a little extra attention. And then also in her spare time, her full-time job as a nurse practitioner. So we're going to get into all the things. So Allison, thank you so much.
Of course. Thank you for having me, ladies. I appreciate
Yeah.
it.
So Allison, let's go back to where it all started. So obviously you're a doctor too, which is awesome.
Nurse
But
practitioner.
nurse practitioner, but let's be honest.
We're better.
Yeah, I mean, who does all the work? I mean, who do you see when you go to the doctors? It's the nurse
We've
practitioner.
had our years of wiping butts and doing all that.
She's a doctor, okay, in my mind. But yeah, how did you get into that? And then, what kind of specialty do you focus on in your medicine? And we'd love to hear more about that.
Yeah, definitely. Well, I'm originally a New Yorker, and I went to school up in Boston. And I thought I wanted to be a doctor. So I did all the medical school things. But I decided to take a year off and move to Colorado because my uncle was out here and I freaking love this place. It's like the best place on earth. And so I moved out here and I got a job working with 3 nurse practitioners that did hormones and women's health and like nothing I'd ever seen in my life. And I just fell in love with it. Unfortunately, I had gotten into medical school back east. And so I had to leave Colorado and go back to New York to go to medical school. And it was August 2001. And as you know, something happened in September of that year.
Yeah.
And so I was in New York. I was in Long Island, right by New York City. And I was just like, God, I want to be a nurse practitioner. I want to do what those women do out in Colorado. And frankly, I don't want to be in New York anymore. I want to be out in Colorado. There may have been a boy involved. I won't want that.
Always is. There always is.
Damn it. And so I actually, let's see, like September 20th of 2001, I dropped out of medical school because I lost some friends in 9/11 and I just had the whole experience of it. And I was like, why am I doing something I don't want to do? So I moved back out here, much to the chagrin of my parents. And I went to CSU and got a master's in nutrition because I was a medical school dropout. What the heck else is there to do? And then I went back to nursing school at Regis, and then I went to nurse practitioning school at Regis. And during that whole time, I studied under these amazing women I had worked with when I first moved out here. So because of that, I fell in love with nutrition, functional medicine, menopause. I don't know how you fall in love with
menopause. I was going to say, did you really fall in love with menopause?
I love you.
I was in my 20s, so I loved menopause.
Right, so far away from it, right? I
love menopause. So I became a family nurse practitioner. And while I was doing that, I met a surgeon who did bariatric surgery, which is weight loss surgery. Mm-hmm. And it involves nutrition and it involves psych. And I had a undergrad in psych, and he's like, you're going to come work for me. So he taught me how to do surgery. So I started assisting and working with him. I set up all of his bariatric practices around Colorado. And I had kind of started doing my practice on the side. Then I had kids and I decided I wanted to, be with them and watch them grow up. So I just worked 3.5 days a week.
Nice.
And then finally, when my kids were in school, I really built my whole practice up. And now I just assist in surgery 2 days a week. I'm not like an employee of them. I'm my own boss for my practice and for surgery.
Good for you.
Nice.
Yeah, so I do surgery 2 days a week in Denver, and then I have my own practice 3 days a week.
So it sounds like a good balance, right?
Did the boy stay in the picture? Is that the husband? Okay. But he was
broke my heart.
Oh,
Yeah.
okay.
But
The boy lives only a few blocks from my kid's elementary school,
Oh,
too, so that's always fun.
oh
yeah.
my God. Does he have kids at the school?
I have no idea.
Okay, well, that's good.
Not, I will say the last time I saw him was the first day I did the I Love Logan race.
Okay.
At 5 a.m., I was out preparing the course, and he ran by me.
Oh my
I was like,
gosh.
no, not today.
Yeah.
But it was the first and it's the last time I've seen him, and that
Isn't
was
isn't
9.
it always that way? Like the people you don't want to run into, you feel like you just run into them more than not, right? You're like, I never want to run into this person again. You're like, oh, I just saw them at Whole Foods.
Well, I'm always predicting that it's gonna be the day I have no makeup on,
Yeah,
and
yeah,
completely like crap, and I'm like,
totally.
grocery store hungover or something. You know what I mean?
Right.
That's how it's gonna be.
Yeah. So tell us, I definitely want to dig right into the kiddos. So
Mhm.
tell us what happened. So you got pregnant, you got married, you got pregnant, and then
Yeah.
yeah, tell
Yeah.
us
So
when it started.
we actually weren't going to have kids. I didn't get married till I was 31, 32. And I was going to be a career woman. I wasn't going to have the kids. And then around 33, all of a sudden I was like, wait a minute. Oh, God damn it. I want to do this. So I had Logan, who's my son, in 2011. And so I was 34 when I had him. And you just assume your kids are going to be healthy. And when he came out, he was gorgeous and, little towhead, little boy, and first grandbaby for all grandparents. I mean, my God, he was spoiled rotten. But we started noticing that he hated light. So we kind of called him our little vampire baby. We had like shades everywhere in the car, and we'd always like turn the blinds down in the house. And then on playgrounds, he would really struggle to kind of like do steps, or like he was like just a little tentative going down slides while all the other kids were like going bonkers on the playground. So I want to say around age 2, I started taking him to the eye doctor. My husband, when he doesn't have glasses on, he's legally blind, but it's correctable. So we just assumed he needs some glasses.
Sure.
So we kept going to this one eye doctor, who I will not name because I don't love anymore. And we just kept saying, like, he needs glasses. Come on. And they kept going, come back in 6 months. He's little. He can't read the
Right.
chart. He
Well, how
doesn't.
do they even tell at that age is my question. Like when they're 2 years old, like besides, looking in their eyes, how do they know what they can really
Right.
see or
And
not?
they barely look in their eyes. They
Right.
would like put these pictures up on the wall of like a house of a bird. And they'd be like, what is that? And I'm like, no, come on. Like,
Right.
so I always got really annoyed with the process. So finally, one day I said to my husband, I'm like, okay, I'm taking him to the doctor and I'm coming home with glasses. Like, this is ridiculous.
Mhm.
And in the meantime, I had Zoe. They are a little less than 2 years apart from each other. So I have a newborn who I'm like breastfeeding in the waiting room. And, they put the dilating drops in Logan's eyes. So you have to stay there for an hour and wait. And finally, we took him back, and the doctor was like, I'm going to look in the back of his eye. Let me look. And she looks for 5 or 10 minutes, and she's like, huh. And I was like, okay.
Never a response you want to hear, right?
I know. Yeah.
But it gets worse. So she walks out of the room and she says, I'm going to go get my colleagues. So 3 doctors all come in and they're all looking in his eyes. And if you've ever seen, what is it? The Leo DiCaprio movie where he's like running away. He's a pilot. He fakes being all.
Oh, yeah.
You can. Yeah.
Yeah.
That's right. And the one part where he pretends to be a doctor and he's like, I concur.
Yeah.
All like, I concur. And I was like, what are you concurring about? And so they all walk out, and this doctor writes down on a piece of paper a name and folds it up and hands it to me. And she said, I think this is what your son has. There's nothing we can do about it. You need to go get a test done at Children's Hospital under anesthesia, and I'll send you his name, later today.
Mm-hmm.
Okay. And she walked out of the room. And I was like, what the hell is happening? So, of course, I get in the car, I strap all the kids in, and I do what any good person does. I looked on Dr. Google.
Yeah.
Opened up the paper, and it said the words retinitis pigmentosa. No clue what that was. God, in nurse practitioning school, I hated the eyeball. I wanted nothing to do with it.
Thank God you had Google. I'm just gonna say, like, I know it's a
Yeah.
blessing and a curse, but when you get a diagnosis like that, to be able
Mhm.
to at least look it up,
Yes, which
like,
is good and bad though.
yeah,
Yeah.
no, I know, yeah.
Yes, because I look it up and it says a blinding disease with no cure.
Yeah.
Like I'm in my car with two
Yeah.
kids screaming in the background, like having to drive home, just like a truck just ran over me.
Right.
So I get home and God, I remember the day so vividly. I like put the kids down and Jenny, I know you do this. I run. That's my therapy.
Yeah.
So my husband actually got me a shirt that says I run because murder is frowned upon.
Yeah.
Oh,
Love it.
Totally true.
Yep.
So I was like, I need to go for a run. And I
Yeah.
like gave the kids to my husband and I went out onto our trail. And I think I got about a mile out and I couldn't run anymore. Like my lungs seized up, like everything just stopped and I couldn't move. And I just broke down in the middle of our Dry Creek Trail out here. And I could like barely move. Like it just finally hit me. And it was a ton of bricks. It was a really hard thing to get.
A lot of tears are shed on that trail. I will say, I see people all the time. It's like,
it's
it's
true.
where I go for like therapy, you know?
So true.
We're
It's
lucky.
the best for therapy, except for your knees.
Yeah. Yeah.
So we ended up going to Children's Hospital, putting my son under anesthesia. They did this test where they flash little lights into their eyes, and then they watch their brain activity to see if they register it. And I had never met this doctor before. This was a different doctor, and he put my son under anesthesia. Did this? He came into the waiting room, and he's like, "Well, it's a flat line. He has no response to the light. He probably has this disease." And he's like, "Do you have any questions?" And I was like, okay, what do we do about it? And he's like, well, there's really nothing you can do. And I said, do we follow up with you? What do we do? And he's like, I guess you can.
Oh my gosh.
And that's how I found out.
Oh my God.
So I will say I am biased. I'm a nurse, but I ended up going on Facebook, which I mean, again, to your point, Jenny, what would we do without some of these social media things? I mean, they're bad and they're good, but I found this group of parents that have similar experiences. So we kind of all clung on to each other. I needed to get genetic testing to figure out what the heck was going on. And they told me it would be a year before I could even get in with a doctor to get testing. So I actually went on a physician group on Facebook, thanks to one of our other neighbors who Jenny knows. And they all told me I needed to fly to Iowa, that there was a lab out there, that the hospital was amazing. So I actually called them and I got a nurse on the phone, and she was like my guardian angel. She's like, Mom, we got this.
Oh.
Come on in. We're going to get him tested. We're going to figure it out. It's not the end of the world. It's going to be, and it was just one of those, like, I just needed someone to tell me that it was going to be okay. Because no one else had a clue. Right. And so we flew out there. We found out what gene it was. It's the gene called RDH12. And what that means is he has something called Leber's congenital amaurosis. We call it LCA. There's 21 different genes that can cause it. So we're one of them. We're the 13th found. And what it means is they don't make an enzyme called retinol dehydrogenase. And all that enzyme does is it cleans the vitamin A off your rods and cones in the back of your eye. So because they don't make it, they're not cleaning the rods and cones.
So it's just getting dirtier, kind of, basically.
Exactly. They get dirty and then they die. So that's kind of what happens. And when people ask me, well, how does that look to the kids? Well, I don't really know.
Yeah.
Right.
But how I kind of explain it is you take a piece of cardboard, punch a whole bunch of holes in it, and they can see really well through those holes. And then as time goes on, they get less and less and less holes. So that's kind of the best I can describe it.
So before we get into, because I obviously want to talk more about the kids, but the whole experience with, you're obviously in the medical field, your experience with these doctors and the diagnosticians, how did that shape you as a medical professional and your bedside manner?
It has changed so much.
Yeah.
I will say the blessing of being a nurse practitioner is we have so many years of being a nurse and caring for patients that, we know how to do that. Unfortunately, I think in medical school, they don't get that opportunity to really be at the bedside and do the dirty jobs.
They should teach compassion, right? There should be a class on compassion, and I don't think that
in
exists, right?
every organization, I mean, empathy is such a huge piece of every job you do.
Yes. Yes. And I hate to say it because I've set up when I set up bariatric programs, we set up a computer program to teach all the doctors about bariatric empathy. And, they don't watch it. And then they just take the quiz at the end. And you're like, well, that's all the teaching they got.
Right.
So I think the other thing I learned is more, I understood things from a patient side.
Yeah.
A practitioner, you're always on one side. And so to be on the other side and have a doctor just hand you a piece of paper with a diagnosis and be like, be on your way, there's nothing we can do. I would never do that to a patient. And the other words of advice I have are don't ever just take one person's.
Yeah.
We've talked about that before, like the value of multiple opinions and
yes. And I will say, I mean, we're blessed that my husband and I do well enough economically to be able to fly to Iowa, to be able to find providers, to know other doctors. I know so many people out there that their kids got this diagnosis and they just kind of went, well, there's nothing I can do.
Yeah. Yeah. And that's what the doctor's telling them. So they're taking that. Yeah. And they can't get a second opinion.
That's right. And then these kids they don't get taught stuff. They don't get good educations. They just get left behind. And that's why right now there's obesity is huge in blindness. Unemployment is huge in blindness because they're not, oh, you're going to be blind. Just there's no point in teaching you this stuff. And it's kind of a travesty at this point.
So let's talk about your daughter. So your daughter also has this condition.
She does. So Zoe, who's now 11, we thought she was fine. She didn't have any of the symptoms that Logan had. The other thing we saw in Logan was we call him his googly eyes. He always kind of had a nystagmus or a bouncy eye. And she didn't have that. I mean, she ran around the playground. She was, just like a typical child. And she is what we call our bull in China shop because there's no, she doesn't tiptoe around anything. And we were like, oh, she's going to beat up all the kids that make fun of Logan. She's going to be like, crutch. This is going to be great. And I remember she was 3 years old. We went out to dinner. I remember the booth we sat in, the restaurant we were in, what we ordered. I turned and I looked at her and her eye started bouncing.
Oh, shit.
And and it was like that moment of like, no, this can't be true. So I actually called my nurse in Iowa, who was my hookup, who was my everything. And she said, again, okay, Mom, it's going to be okay. We got you. We're going to get some labs drawn. We know what Logan has, so we can easily figure out if this is what she has. And a month later, we knew that she also had it.
What's shocking to me, and I know that this is like kind of crazy, but you think about when you said you couldn't get into a geneticist for, over a year. And I'm thinking, shit, we can get DNA tests for our dogs now. Like,
it's
insane to me that you can't get the help that you need. And
well, the problem, I mean, I think it's getting a little better now, but I mean, genetics was somewhat new in the world, 10 years ago. And now it's becoming more common. But I actually just had a friend diagnosed with something and she said it was 8 months to get in still.
Wow. Yeah.
But I think that's also medicine these days.
Yeah.
God, try to get into your primary care or a cardiologist. And you're waiting 3 to 4 months.
Yeah.
So Allison, go ahead.
My mom had an issue. Sorry, Lori.
Go ahead.
My mom had an issue and my dad had just passed away like a few months prior. And so she had some chest stuff going on. And so she was very concerned about her heart. And she tried to get into just the general doctor, not even a cardiologist. And they said, we can get you in. It was like 4 months away. And my mom, who is the nicest person ever, she's firm, but she's like super kind and doesn't hurt feelings.
Yeah.
She goes, hope I'm not dead by then. And she hung up. But I mean, it's so frustrating because it's scary and you're so vulnerable. And then you're being met with just like, sorry, nothing we can do, basically.
That's right. That's right. I think that will say when I will say I sometimes abuse my position that if I have friends or family, like I will call that doctor up and be like, I'm referring them to you.
Yeah.
You need to see them. And I actually, my mom, same thing. She has high blood pressure and it was off the charts. And the doctor was like, I'll see you in 2 months. And I'm like, no, this is
After
not.
you have a stroke, I will. Yeah. Does that cause a stroke? Am I right in that? Okay.
Yeah.
Your stroke rehab.
That's right.
So my question, Allison, that I was going to ask a second ago was, so because both of your kiddos have it, is this a gene that you and your husband carry, or?
Yeah, so it is what we call autosomal recessive. So what that means is apparently I have a little tweak on a gene and my husband has the same exact tweak.
Wow.
None of us have vision issues to this extent. No one in our family. I mean, we have some really distant family members who have some blindness. My grandfather actually was legally blind for a completely different reason, which is kind of crazy. But we just, lightning struck. We happen to have the same little tweak on our gene. And it's a 25% chance, if you know genetics, it's a 25% chance that these genes would be passed on to our kids. And it happened twice.
Wow.
So we don't play the lottery in our house. We don't ever expect to actually win anything.
You know what? It's so funny. I would think the opposite. I'm like, you had these crazy odds and unfortunately met them, but maybe it'll work in your favor.
We won the crap lottery. We didn't win the good lottery.
I know.
Instead of $1 million, we get blindness.
Yeah, exactly. Oh my God.
So I'm curious, we all have obstacles as moms, right? So how has this changed us the extent of, being a mom in general, right? We deal with, and your kids obviously are kids and they're going through the same, emotions as others, but now they have this other, challenge, if you want to call it that they're dealing with. How do you deal with it and how are they doing with it?
I run a lot. I cry in the shower. No, I will say I was really upset in the beginning. I really struggled to just function for a little bit because it was such a, it was such a hit. And I will say with Zoe, I remember when she got diagnosed, I came home and I called my best friend who was living in Pennsylvania. And I just said, she has it too. And my best friend's like, she has what too? And we just both like cried together on the phone. And, it took a long time to kind of get out of that hole because when this happens, and it doesn't matter what the diagnosis is. I mean, it could be ADHD, it could be, anything in your child. You expect them to be healthy. Yeah. And so you go through the phases of guilt, like I gave this to them, or maybe I wasn't supposed to meet my husband and have kids with him because look what happened. That you have anger that it happened. You have sadness because, I will say, and I think most parents that have things that happen like this to their kids is you kind of mourn the life you thought that they were going to have.
Well, and it's interesting because you do that even when everything is going well and they make a different choice. So I can't even imagine what that would look like.
That's right. I was a soccer player. I did all these things. I'm in medicine. And it was like, my kids will never go to college. My kids will never get married. My kids will never play sports. My kids will never have friends. That's what you go through. And you make up stories in your mind. And I think that that's kind of the biggest thing I learned. And I would pass that on to any parent that just had someone who's diagnosed is these are stories you're making up in your mind. These aren't truths. At this point, of course, my kids struggle. I'm at IEPs. I go to 4 IEPs a year. One is bad.
Explain what that is too, just in case people don't know.
So an IEP is an educational, it's basically like a plan for your child in school. So some kids will have IEPs that have severe disabilities or deficiencies, and it's spells out all the requirements that the school has to provide for your kid. Like my kids, and I will say we are beyond blessed where we are. My kids both have TVIs, which are teachers of the visually impaired, and there's not enough of them in the world. So please, people, become teachers of the visually impaired. It's an amazing career. And I will say most of our TVIs are people that have either had blind parents or their kids have become blind and they've decided to go on and learn Braille and help other kids. But we have all these accommodations. It gives accommodations to the kids at school. So they have longer time for testing. They have a vision teacher helping them. My kids do mobility. So they go out for an hour a week and cross streets and get on buses and, cook meals and learn how to use a fork and a spoon and do all of this stuff. Because let's face it, we learn by watching people do stuff, and my kids can't do that. So, it's a lot of, as a parent, it's a lot of me trying to teach them stuff that normally you just pick up vision wise.
Sure.
You can't. So, it's changed my life. I'm a different person because of it. I still have my times where I cry in the shower or, I'm running on the trail. And if Jenny ran by, she'd see I have sunglasses on because I'm like, and it comes and goes more now. It used to be all the time. Yeah. Now it's, something happens and I grieve that for my children. And I as parents, we take it in.
Oh, yeah.
If our kids are having a bad day, our day is ruined.
Yeah.
But the funniest part is my kids will have a bad day and the next day they'll get up and they'll be like, oh, they run around like nothing.
Oh, yeah.
Oh my God, I'm still floored from that.
I used to say when I dropped the kids off at daycare and I had to stop dropping them off, my husband had to start doing it because then they would cry and my whole day would be ruined. And within 10 minutes, they were fine and running around, right?
Totally.
But yeah, you just hold on to it.
Oh, totally. As moms, there was this amazing study that just came out, that said as moms, when we're pregnant with our kids, we acquire their DNA in our bodies. And it speaks to how connected we are to our children. We have this DNA connection to them. Dads are amazing, but let's face it. Moms.
We just talked about this because Lori, you and I were talking about this, weren't we? Like moms have the I was listening to something where it's like
moms do all things, right?
Their jobs. And when they're little, that means like moms usually change diapers and dry tears and take care of them when they're sick and stuff like that. But when they're older, we take on all the emotional and all the worry for them. Totally. And my husband will be sleeping soundly, like, why are you worried about it? There's nothing we can do. And I'm like, my mind is racing, Well,
it even goes to like when they're outside, right? Like, or they're at a playground. And as a mom, you're always like, you may be like not staring at them the whole time, but you're always like, are they okay? What are they doing? Dads are like talking to their buddies, like, oh, where's the kid? Like.
Or my husband would be sitting in the room with us and we have a full conversation. And then I'll be like, right? And he'll be like, what?
Yeah.
Weren't you here with us? Didn't you hear this conversation? The kids need something. And he's like, wait, what? Repeat that.
I don't know if you've ever seen, there's this funny thing that goes around on Instagram and there's this kid going around asking his mom all these questions like, Mom, where's my coat? Mom, where's my shoes? Mom, where's my backpack? And then, he's like, Dad, where's Mom?
Yeah, exactly.
Totally. That's because we're superheroes, right?
So how has this impacted your relationship with your husband?
Yeah, that's a great question. What I have found over time is that when you have a life event that happens, especially with your kids, because they're your heart on the outside, and something happens with them, it either brings you closer or it pulls you apart. Yeah. And I will say my husband and I are very different people. He's an engineer, he's black and white, and I'm this touchy-feely, nurse practitioner kind of person. And I did not take no for an answer. I found the providers. My kids are in studies. My kids played hockey. They're everything I can get them into, I get them into. And my husband is just like this rock of like, I don't think I ever saw him cry when when they got diagnosed. And he'll tell me, oh, I did. I cried. And I'm like, if you had stood in front of me, maybe that would have made me feel less like a freak during this. Yeah. But, I do think it takes its toll. It definitely, the way we reacted to it, definitely changed our relationship. And I think we're working to try to mend it, try to bring it back together, because we're always going to react differently to things, especially with my kids.
Yeah.
It's a hard time. And I will say my son, Logan, right now, we have him in therapy. And he goes every other week. And it's not necessarily because he's like breaking down and crying. And I mean, he's like an amazing kid, but I want to give him coping skills that I didn't have when this happened. So I think therapy for the kids, and I think therapy for the parents. I mean, this is a huge life shift that you didn't, I mean, God knows we didn't expect to have blind children.
Sure.
Anyone who was blind. Like I knew nothing about blindness. And now because of my kids, we've met adults and kids and families. And I mean, my respect level for these adults. I mean, I know blind adults that have PhDs, 4 children, take the bus everywhere, do everything. When my kids got diagnosed, I was like, my kids aren't going to do anything. Like they're never going to leave my house. They're never going to have education. And now I'm like, what college are you guys going to?
Yeah.
Right? Like, let's do this.
Yeah.
Need to go to college with you? I guess I'll go to college with you.
I like
Darn.
to learn.
That sounds really fun, actually.
That's right.
I love it. But
Let's talk about your run, right? So you do this
Yeah.
run every year. Let's talk about that. And let's talk about where the research is too, you know.
That's what, I want to hear that too.
So as far as the research goes, I think the best thing I've learned is not to put all your eggs in one basket ever when it comes to research. It's always 2 steps forward, 2 steps back. Once it's a yo-yo of emotions. I will say when I started, so the problem is that this disease my kids have is so rare. There are maybe 300 people in the US with it.
Wow.
We have a international group. We're all on the phone together this past weekend. And so we have people in India, China, Latin America, Europe. We're all over the map. We all get together. We're parents and adults with this disease, or parents with kids that have this disease. And so it's really, really rare. And the problem with that is when you think about pharmaceutical companies, we'd like to think they're making these medications out of the kindness of their heart because they want people to get better. But let's face it, they're doing it because they want to make money. And so to make a medication or do a genetic research clinical trial, it's about $10 million to do.
Wow.
And so to have a pharmaceutical company invest in this research, then they, maybe have 1,000 people, 2,000 people that could use the treatment. They're not going to make a dime.
Mm-hmm.
So this is the fight of rare disease.
Mm-hmm.
We can't get people to fund our research. We can't get people to push it to the finish line because these pharmaceutical companies won't make any money off of it. So that's where we are. And so in 2009, a few parents whose kids had RDH12, which my kids have, they all met at a conference and they decided to make a foundation called the RDH12 Fund for Sight. Mm-hmm. And that was in the US. And I found them online when my kids got diagnosed. And the point of the foundation is to raise money because our only option is, if no one else is going to do it, we've got to raise the money for the research. So they've been doing it since 2009. It's 2024 now, and between international and all the fundraising, in total, we've probably raised about $3 million. Mm-hmm. I will say it's very frustrating because we have many families in our group that fundraise every year and are on it. And then we have many families that don't do a darn thing. Yeah. And it's really hard as a parent to be like, how can you not? Yeah. But that's when someone reels me in and says, everyone's not you. Yeah. Right? Like some parents are just like, oh, someone else will figure it out.
It's a hard life lesson.
It's a life lesson. That's right. So we do our fundraising here. We do fundraising all over the world at this point. We've had 2 companies. About a year and a half ago, we had 2 major companies, and if I said their names, you would all know them, saying that they were going to fund it, promising us the first quarter of 2024, research trials were happening, we're there, it's happening. And then one lost funding, the other one lost interest. And so it's always up and down. So at this point, we are giving $1.6 million to one of the companies in Pennsylvania to try to keep them alive and going. And then the other company, a fellow, when you talk about badass mom, she is the epitome of badass mom in London. I mean, she would lie down on a train track at this point to get funding. Yeah. And she is working on getting a foundation to buy the research from the other company to try to keep it going. The hard lesson we learned is in the beginning, we gave a lot of grants, like $100,000 grants to some companies. And because we didn't own the research, we were just giving them grants.
Oh,
When the research stops, we don't own it. And that university or that researcher owns it, and we lose it all.
wow.
So it's been a learning curve for us. I mean, I'm in healthcare. I'm not a fundraiser. I ask anybody. I don't ask for help. It's my major flaw in life that I'm like, I can do it by myself. And now I'm asking everyone for help. I'm asking them for money. I'm asking them to spread the word. And it's been a real eye opener for my life to learn how to ask people for help. And I think a lot of moms are that way. We're not good at asking for help. But, you know, when a child calls, the mama bear comes out and you're like, what do I have to do? This is happening.
Absolutely.
So, so we keep raising money until we can get to the finish line. And some years we think we're close, and other years we're like, God, we started this like 15 years ago and we're still in the same place.
Yeah.
And the sad part is it's a really easy cure. I mean, it's a simple, they've already done it. And remember I said there's 21 LCAs. They've already cured one of them.
Really?
Yep. And so they do this genetic, they actually will inject the gene that they use what we call a virus or a vector.
Okay.
So actually the vector for the AIDS virus. It's not actually AIDS, but it's that vector. They put the gene in it until they inject it into an eye, and their body then makes the spell correction. Right?
Wow.
There's an incorrect spelling somewhere in their genes. We just put the right letter in, and their body starts making it.
Wow.
And so they've already solved one, and it's a matter of like, okay, ours is very similar. We should just white out that gene name and put our gene name.
Yeah.
It's not that easy, but we know that it works. And I know that I can stop my kids from losing their vision. And the hard part is money is what stands in the way.
Well, and there's a timeline, right? I mean, that's the hardest part is it's like, yeah, it sounds like at some point it will happen. But in the case of the kids, like there's going to be a point when it's too late. Like you said, it's can't be reversed.
Yes. I mean, at this point, we're always fighting against the clock. But I will say I've kind of shifted to the point where it's like, you know, my kids have learned and they're continuing to learn how to thrive in this world if they need to blind. It's not a death sentence. Like I said, I know a ton of blind adults that are just crushing it.
Yeah.
But if we can stop the degradation and potentially do stem cells or a retinal transplant in the future, there's always hope. But if we can't do it for my kids, I want to do it for another mom out there who's going to get this diagnosis in 5-6 years, whose life is going to just dramatically change.
Yeah.
So yeah, I mean, it's a hard pill to swallow. I'm a control person and I have no control over this.
Yeah. Which is, and like you said, that roller coaster.
Yeah.
It's like, we're moving forward, we're going backward. And knowing that it's possible and not being able to do it makes it that much harder.
That's right.
Yeah.
So what do you guys do as a family? Like what's something fun that you all like to disconnect and go do and, with the kids, with your husband, where you can kind of, you can't just like forget about things, but those moments where it may be a vacation or, doing certain things together.
We decided when they were both diagnosed that we were going to we set up a bucket list of all the places we want them to see before they can't see it anymore. So we've taken some amazing trips. My kids are extremely spoiled, I will say. Of course, COVID kind of got in the way of that. Yeah. And let's homeschool learning with 2 kids that are visually impaired, and everything was visual on a computer was a treat. I actually had to move all my work hours. My parents chipped in, everyone chipped in and sat at the computers with them. We'd have their vision teachers on iPads. You just see their face sitting on the desk with my son trying to braille stuff. I mean, it was,
oh my gosh.
The gym teacher would crack up because he'd be like, okay, kids, it's time to do yoga. And he'd be like, I see Logan's mom is joining us today. well, he can't see what moves you're doing. So I've got to like move his body in that direction. So it was a comedy of errors, that's for sure. But I mean, we've gone to Alaska, Costa Rica. We're going to Switzerland and Germany this summer.
We should talk. I just went.
Oh yes, please.
Yeah.
My husband went to high school in Germany because
Oh my gosh.
that. So we want to show him that. We've been to Hawaii. I mean, we've done great things. We don't ever hesitate to say yes. If someone's like, come to California, come here, and we're like, we're there.
Yeah.
My husband and I like to hike, so we force the kids to hike with us. It's always interesting on a trail when, everyone else sees my kids. Well, my daughter doesn't, but my son will sometimes use his cane on the trail. Yeah. And that's a whole nother Oprah right there, is seeing parents and kids staring at my kids with their canes. I've had people come up to me and say, I'll say a prayer for your child. And I'm like, what? Like, don't say that to me. My kid is amazing. And so, I mean, there's so many hard times.
Yeah.
And I will say I've resisted the cane for a long time, because then that like makes it real.
Sure.
They can't see. But now I'm just like, screw all of you. Look what my kid's doing. Like, he's out there, he's hiking this trail and he's doing a better job than you, but he's complaining the whole time. But,
right.
But that's every child, every kid, right? Like, it doesn't matter.
My friend called them forced marches for
that's
kids.
right. That's right.
They have so much energy, but yet they can't walk like a couple miles, but they can run continuously.
They walk 4 feet and they're like, my legs are tired. And you're like, but I mean, my son rock climbs. We go indoor rock climbing all the time because it's a really tactile kind of activity. My daughter's skateboarding now. She's taking skateboarding lessons with this amazing coach who like holds her hand around the skate park. My kids played hockey with the Avalanche.
Oh my gosh, that's amazing. My son plays hockey, so I'm
they played. It's fun. They played with the team called the Visionaries, which is a blind hockey team in Colorado.
Oh my gosh.
And they play with, instead of a normal puck, I should grab one. It's like a coffee can, but cut off. And so it's this tin kind of coffee can, but it's squat, and it has little ball bearings in it. So when they hit it, it makes noise.
I hear it.
And then they slap their stick on the ground to say, like, pass it to me.
Oh my gosh, that's so cool.
It is. It's crazy. And the goalie is the blindest. You have to be completely blind to be the goalie. That's the rule. And I'm like,
really?
What? Wow.
Yeah.
What?
It's crazy. My daughter horseback rides because she has horses are so therapeutic. And such a connection to them. So, I mean, my son's a coder. He is a computer genius, way over my head. Yeah. And we actually really struggled to find a program. I mean, there's all these programs for kids to do coding, and they're all visual. So we called around, we fought really hard. And I actually found a professor at CU Boulder who hooked me up with a student in New Jersey, and my son Zoom calls with him. And this kid just helps my son learn how to code and do everything without using vision. Because the computer can speak to you, it talks to you, gives you prompts. So
that's amazing.
Technology has really helped my kids. That's
for sure. Oh my gosh. I mean, I will say your kids are involved. When you think about the average American, and I'm thinking about people that on the trails are like staring at your kid. Do you know how many people are sitting home on the couch? I'm like, really? They're out there. They're doing all the things.
Yes. But let's face it. My son can't really see well in school, but he can see Fortnite.
Well, right. It's
spend hours and be like, Mom, look, I just killed this guy with this new gun. And I'm like, I'm so proud.
I never thought that would happen for you.
Oh my goodness.
I love it.
So I all of this is just, I mean, you are obviously like beyond a badass mom. I mean, I think you're such an inspiration for everyone, and for moms that are dealing with any kind of struggles. This is a hard question, but what are you most proud of?
I would say it's not necessarily, you call me a badass mom and I appreciate it, but I'm just being a mom.
Yeah.
I love my kids, and I'm going to do anything I can for them. I'm most proud of that. They're my kids.
Yeah.
I mean, I'm jealous of I see all these kids running around and I get mad at myself for feeling jealousy that my kids can't throw a football or play soccer or do these certain things. But I'm most proud of them because they have this disability and they're still getting A's in school. They still have friends. They're still doing their thing. I guess the thing I'm most proud of is that they proved me wrong.
Yeah.
Oh, I like
I
that.
love it.
That's
Um,
amazing.
they're amazing kids and they have their moments. I mean, I've cried tears with them, next to them.
Yeah.
I don't hide that from them because they need to see that sometimes this really does suck.
And they have to be like, it's okay that it, like, they can be sad about it and
That's right.
frustrated and all the things.
That's right. And I think the biggest motto we kind of have in our family is it's not a disability, it's a different ability.
Yeah.
We just need to figure out how to do it different. And we're going to be frustrated and angry and sad and pissed off. And then we're going to move on and we're going to figure out how to make it work.
Yeah.
And the skills that they're learning that they probably would have never like really dived into, like for them, it's opened up probably so much, just like you said, different, right? Different ways of just, seeing the world now and being able to adapt to, things as I get older. So
Totally. And I would think there's a few big lessons I've learned is one, you kind of find out who your true friends are when something happens like this. You find your community and you find your people, and they will fight viciously for you and your kids as well. The other thing is, and I think this goes not just for a parent who all of a sudden has a child with a disability or that's injured or whatever it is, it goes for anyone dealing with a situation they didn't expect. Don't let anyone tell you how you should feel about it.
Yeah.
I mean, the things I was feeling, the things I was thinking, the things I still feel and think. I mean, it's not like one of those things where you grieve it and it's done.
Oh, sure.
Yeah. I mean, with my kids, I grieved it and then I got used to it. And then my kids will lose a little more vision and then I have to grieve it again. And then, so it's this constant reshaping of how I think about stuff. But I had so many people saying, you shouldn't think this way. You shouldn't feel that way. And now anytime the patients I talk to, friends I talk to, it's like, you feel what you feel.
Yeah.
It's legit. It's what you're feeling. You go through it, you feel it, and you don't let anyone tell you not to feel that. Because
and don't let anyone tell you what your kids are capable of or what you're capable of.
That's right. That's
including
right.
yourself.
That's right. I mean, we have enough self-doubt, right?
Yeah.
And moments where I'm like, I can't do hard things. And then you're like, I can do hard things.
Yeah. Yeah.
So Allison, tell people, how can they donate? How can they be a part of the run? Like, let's get it out there.
So August 18th is our run. It's in Westminster, Colorado, right by the Westin. It's a 5K. It's a silent auction. We have face painters, balloon animals. Bernie from the Avs always comes and plays with us. We have a live band who's actually my brother's band.
Oh, nice.
They play polka, but they play death metal polka. But they actually will like make normal songs that you hear, like they play Lady Gaga in polka form, and like they're really fun. So at this point, we're looking for people to come run. We're looking, if you don't live in Colorado, donate. You can go on the page. It's I Love Logan, EYE, like the I, Love Logan 5K. It's a website. It explains the race, but there's a button on the top that says donate. So you can just donate if you want to. We also have a website called RDH12 site.org. It is the main page that I actually created. I'm the president of our board here in the US. It explains the disease. It shows you pictures of some of the kids. It explains where we are, where our funding is going, and you can donate on that page as well. We're looking for sponsors. So if anyone has a company and they're like, I need a tax deduction and I want my name on the back of a t-shirt, we do great t-shirts. We love sponsors. We're looking for silent auction items. I mean, basically, we will take anything. We appreciate everybody. And it's been really hard, 9 years of asking the same people for money. I'm like, I'm sorry, I'm going to ask you again for more money. And at some point, our plan is to have the I Love Logan, and no one has to give money. No one has to donate. It's just going to be a celebratory 5K that we got to clinical trials and we solved this issue. That's the plan.
I love it. That's awesome.
Yeah.
Well, we will be there cheering you on the whole way
Thank you
and
so much.
supporting you, and we'll share all the links. So,
Appreciate it.
yes,
Yeah.
absolutely.
Thank
Yes.
you so much for joining us today. And I like I said, I really hope that you're an inspiration for all of our listeners. And you know, I can't wait to hopefully see, you know, what happens with all the good stuff you guys are doing.
Yeah,
So
we'll keep you updated. And thank you for doing what you guys do.
Yeah.
Because you guys are badass moms for doing this.
Well, thank you.
Thank
We're
you.
very grateful that we get to hear all these stories.
Yes.
So thank you for sharing, being vulnerable, all that kind of stuff.
Yeah.
So,
Of
Thanks
course.
so much.
all right,
Great.
take care.
So